All right, so we're going to get started with reflexology for tinnitus. It's actually crazy because the client that I had that was the cause of actually creating this, his problem was he couldn't hear. Like, and so I sent him to an audiologist, and in his left ear, the audiologist came back and said, I got 20% or that he had 20% hearing. And in his right ear, he had no hearing. And his devastation was he couldn't hear his grandson. Like it broke his heart because his grandson's 4, and he just wanted to be able to hear his grandson. That was the driving factor behind it. And she's a wonderful lady. I absolutely love her. But I remember taking a stroke protocol from her a long time ago. And so as soon as he said ear stroke, and I'm like, okay, this is what I'm going to have to do. We're going to have to go and we're going to have to figure out exactly what's going on with this stroke thing to try to get it back. And so I pulled out all of my tools because I didn't know what to do. And it was foot reflexology, this protocol, ear reflexology, hand reflexology, and emotional reflexology, all of them. And um, plus I added ear seeds. And so after the first session, he came back and he said he could hear a little bit better, but his tinnitus was gone. He didn't tell me he had tinnitus. I'm like, what do you mean your tinnitus is gone? Like, that's the hardest thing to get rid of ever. What do you mean? And so, yeah, sure as heck, we were gauging it. And it left, but the audiologist had give him like a little hearing aid looking kind of thing, and it had what they call pink noise. Have you ever heard of pink noise before? Me either. And so they had this little hearing aid thing that had pink noise in it, and that was supposed to help the background noise for the tinnitus. So he was wearing that at the same time that he was kind of doing the sessions. And then eventually he went to the audiologist actually last week. So I just got the update last week, Thursday. And he's got 75% hearing in his right ear and 100% in his left, according to the audiologist. And he gave back the pink noise hearing aid because he doesn't need it. He doesn't have tinnitus anymore so far. So for those that don't know me, I was certified as a foot reflexology therapist in 2010. I beat anxiety disorder in 2012. That's why I developed emotional reflexology that we do use in this training a little bit. And I have taught hundreds of students at this point, and I'm a strong believer that impossible can become impossible with a little shift in perspective. So welcome to reflexology for tinnitus. You do have to attend this class at least once live in order for me to be able to send you your certificate, because I need to make sure that you're doing everything correct. So if you have registered for this training, but you have not attended live, let me know, and you are going to have to be moved to a future class, and so that I can see you actually do the session. Now, in this training, there are 3 charts, and they are available in the student portal, and you can download them. In order to get into the student portal, you are going to go to kalindatrifo.com, and then you're going to go to Reflexology Courses and click on Student Login. You're going to click Login once, and your password is going to be the information that I sent you in the email in order to be able to log in. And then you get in here. Now, if you're doing this on a cell phone, you have to scroll down past the calendar and you're going to go into the tinnitus workshop. Now, reflexology for tinnitus, the important info. If you miss this class, you can click here for upcoming classes, and I will have to move you to an upcoming date to join this Zoom. This is the link in here. It's important to download this tinnitus guide just because it has all the information in there. There is the replay from the first one. The replay from this one is going to be in here as well. I'll put it right below. In order to be able to do this session, you need some supplies. So you will have the sequence sheet and the method guide in here. There's different method guides based on the sound. So whatever the sound is, these ones here are all the method guides that you're going to be able to use. There are ear seeds. So these ear seeds, they're like $12.18. I guess there's 10 left in stock. Whenever it if you're clicking the link and it's showing that is nothing left, please let me know. It's these guys right here. So the reason I like this is because this pointer, when you get it, it actually retracts. So it's pretty hard to press in and do any kind of hard damage because it's got give, right? You do need to have tweezers in order to be able to put on the ear seeds. And if you don't like these great big huge clunky ear seeds, there are other ear seeds that you can get, and I have put links for them in there as well. The one that I use the most are these they're like little gold seeds, and they're on surgical tape, so they hold for up to a week. We use them a lot in ear reflexology. Ordering this kit is what you need in order to be able to get through what I'm using. And here, if you are curious about other emotion things, I'm actually a certified emotion code practitioner, and I do recommend reading Dr. Bradley Nelson's book, Emotion Codes. It starts to talk about how emotion is trapped in the body. And if you know anything about Louise Hay, she's very good at helping you understand how emotions get trapped in the body. There is an ear model. So this is what the ear models look like. They've got all the different locations. So the principle behind the ear is it's like an upside down fetus. So everything in the head is in the earlobe. The stomach and all the inners is in here. Well, arm, leg, and wrist and stuff is in here. And this is the inners. I've also created session reports. So it looks like this, only it has a notes section on it that you can go and so that you can print it off. This does not replace your other health records. Still use your other health records. It's just we are going to be able to use these sheets to be able to document everything, just and so you can circle or mark or do whatever you need to. Just makes life easier. The other thing that was really interesting is in the first class I taught, Barbara Cross had mentioned that in order for things to be tracked for scientific research, there's a very specific protocol to that. I have added those session reports to this training as well, and we'll go into that a bit later. So let's dive in to the sounds. Now, it's really neat when you talk to people with tinnitus because they often say that there's ringing in the ears or whatever, but it depends on the sound on what the solution can be, because every sound gives us a clue as to what parts of the body are being impacted. Now, if the client explains it as a ringing or a high-pitched bell-like or rumbling, clients who describe this type of tinnitus commonly experience high stress levels, imbalances with the urinary system, or they have symptoms of sadness or depression. For those describing their sound with their tinnitus as buzzing, humming, or machines, clients who describe their tinnitus with these sounds often have digestive and cardiovascular imbalances reported in their health record, or they have been experiencing emotions that make them feel sick to their stomach, heartache, or grief. When it comes to whistling or wind-like sounds, those clients who describe their tinnitus this way often report having challenges with their liver, gallbladder, or hip pain in their health record, or they're experiencing emotions that include anger and or frustration. Clicking, popping, or crickets. Clients who describe their tinnitus with these sounds often report having challenges with their jaw, grinding teeth, anxiety, or high stress levels. Roaring, like ocean waves or a waterfall. Clients who have described their tinnitus this way often report having challenges with the urinary or digestive systems. Emotionally, they may experience depression, anxiety, or suppressed anger. Some clients feel like they've got a heartbeat or it's like a pulsing sound. Now, those clients who describe their tinnitus this way often report having challenges with the cardiovascular system or having emotions connected to depression, anxiety, heartache, grief, or worry. So when it comes to the integration with the emotional side of things, if there is stress or anger, it can raise cortisol and blood pressure, and then tinnitus seems to worsen when they are stressed out. If the report that their tinnitus gets louder when they are feeling anxiety or fear, it's because anxiety and fear can heighten awareness of the internal sounds. When somebody is sad or they have grief, it can lower the parasympathetic tone and it seems to weaken the resilience to tinnitus. If somebody suffers from worrying or overthinking, their hyper-focused attention on their ear sounds and it amplifies the perception of the sound. If somebody has just had shock or trauma, it can dysregulate the nervous system and that can cause a sudden onset of tinnitus. Now, it's important to ask your clients how long they've had that tinnitus for. Like, did it come on slowly? Was it quiet and it keeps on getting louder? Is it something that just showed up instantly? How did that go? And those are important questions to ask and to document in the health record. So, Crystal, you said that you have tinnitus, right?
Yes.
Okay, so how would you describe the sound that you have?
Well, I have two different kinds. I've always described it as static. Like
Okay.
when you put TV on snow and it's that kind of like, or if you lay your head on a pillow and you can hear that sort of crunching, like I have three different kinds. I have a constant that's like a static, which I guess would maybe be like a buzzing.
Okay.
And I have what I call a clicking. Like it sounds like a snapping almost. And then I also, it's positional, but I have a whooshing um, that kind of follows along with a heartbeat. It gets really loud, and then as it passes, it quiets. And that one only lasts for about like 15 seconds to a minute. The static is quite often all the time.
So the static, if I was to find the protocol for it, it would be this buzzing, humming, or machines. Obviously, the heartbeat one, the whooshing one would be more like the roaring and the waterfall. Um, just hold on here. So I think you kind of described four of them, right? So, okay, we're going to go through it one by one. Is there any kind of ringing, high-pitched bell-like, or rumbling?
Ringing sometimes. It'll get really high pitched.
Okay. And
That's when it's really bad.
and then you have got the static.
Mhm. That's kind of in the background all the time, but not when it's bad. That's just kind of the regular, always there.
Okay, so is the static, is it more like a hum or is it more like a wind?
Mm, hmm. Maybe a hum.
Yeah, okay, good. Okay, and then you said that there was a clicking.
Yeah. And that's almost like that one only lasts for a couple minutes too. Like it's almost like if something's draining and it goes like you can hear it go click, 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 but it lasts longer than your ear would clear, you know?
Okay, and then the heartbeat is the other one, right?
Well, it's whooshing. It's like it
Oh,
actually goes shoo, 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 like that, really loud.
Okay, so that would be the waves then, but it doesn't have a beat to it. It's more
Uh,
it's more like a ultrasound sound, right?
right, like as it's clearing and going away, because that one is sort of positional, and it will, as it's clearing, it kind of morphs into just my heartbeat. Like at first it's really strong and really loud, and then it kind of mellows out.
Okay, so you've got
And I've been seeing neurologists for it, but
okay, so would you say that you have high stress or imbalances with your urinary system or symptoms of sadness or depression?
mm, all of them probably. Like urinary system, I had bladder cancer, but and like I had 3 surgeries, but nothing for 10 years.
Okay,
I've never had a UTI or a bladder infection though.
that's okay. Okay, digestive or cardiovascular imbalances, and when you suffer from something that stresses you right out, it feels you can feel it in your stomach, heartache or grief. Does any of that resonate with you?
Stomach issues when I'm stressed for sure.
Okay. And then do you grind your teeth or anxiety or high stress?
All of them.
Okay. And this whooshing. Again, we've got the urinary and digestive, and then depression, anxiety, or suppressed anger. Good.
Um, yeah, all of those too.
Okay, we got them. All right, there we go. Now we know what we're working on for you today, right? That's
Everything.
everything. We're going to work everything. Okay, so emotional triggers and tinnitus sound qualities. If you're looking at it specifically for the emotions according to the sound, the high-pitched ringing or whistling, it's usually anger, frustration, or stress as the underlying emotion that we're trying to discharge. If it's that low roaring ocean sound, we want to get rid of fear, exhaustion, and insecurity. If it's a sudden acute ringing with palpitations, we are looking at getting rid of shock, overstimulation, or mania. If it's a muffled buzzing or a dull humming, it is grief, sadness, or sorrow. If it's an intermittent buzzing, like a blocked ear sensation, that is worry, pondering, obsessing, or feeling mentally overstimulated. Now, beliefs play a factor as well. And the limited belief is feeling stuck, frustrated, or exhausted with current living conditions that may be caused by homework or relationships. Lack is lacking healthy boundaries to protect from an abusive or disrespectful situation. And pressure is feeling under pressure, but too scared or resistant to make a change. Now, when it comes to emotional connections to the organs, that's where things get really fun because with 8 billion people on the planet, no two are the same. We all process things differently, and we have to be able to customize according to the client. So, when it comes to the liver, the things that are going to leave clues is the liver primarily has the emotion of anger. So it's like an angry liver, it's frustration, resentment, irritability, rage, suppressed anger. Other emotional aspects could be feeling stressed or overworked. Workaholics often have this issue, feeling stuck, or the perfectionists in our world, right? The other organs that are impacted can be the solar plexus, the gallbladder, digestive system, the hips, and the sciatic. Now, kidneys, the primary emotion is sadness or grief. So it's things that it's like water, right? Chronic anxiety, insecurity, trauma, survival fears, and the emotional aspects are feeling burnt out, adrenal fatigue, or just plain old deep exhaustion. Other organs impacted are the solar plexus, the eyes, the bladder, and the ears. Our heart is the primary emotion is joy. And the imbalance of that, because joy is a positive emotion, right? Who doesn't want to feel joy? But an imbalance can be mania. Like people that are bipolar, they go to extremes. So they go to mania, and then the opposite of that is like deep depression, overexcitement, lack of joy, or sadness. Other emotional aspects are shock, emotional instability, or heartbreak. Other organs impacted are the solar plexus and the lungs. Now, the lungs, primary again, is grief. It's loss, sadness, and sorrow. Other emotional aspects are unresolved grief, inability to let go. Other organs impacted are the solar plexus, cardiovascular system, eyes, and ears. Our spleen, the key is worry, pondering, thinking, overanalyzing. Other emotional aspects are guilt, obsession, anxiety, tormented by inner critical thinking. Other organs impacted are the solar plexus and the digestive system. The good news is all of this is in the guide, so you don't have to memorize it, right? Now, when it comes to releasing emotions, I figured out how to do this the hard way. I used to have anxiety really bad, and it was truly debilitating. Panic and anxiety are two things that I do not recommend anyone suffer through. It sucks. But I did learn the very hard way that the body remembers what the head forgets. So, what happened for me was when I was very young, I was 8. I was raking with a two-sided rake in our backyard at my parents' home, and my brother was jumping off the rabbit hut. I left, I went to go to the bathroom, and while I was in the bathroom, he jumped headfirst off of the rabbit hut onto the two-sided rake. I did not know when I was 8 that the head has a lot of blood in it, and it leaks profusely when things fly south. And so, of course, my parents were young back then, and they didn't have a cell phone, and they just grabbed their kid and went to emergency. Well, my uncle was staying with me at the house, and my uncle's blind. So he had to listen to this little 8-year-old crying unconsolably because I thought I killed my brother. So, what emotions do you have when you think you killed your brother? Which is irrational thinking, but it made sense to me at the time, right? Well, 5 hours later, my brother comes back with 5 stitches to his head, and everything should be good, right? Wrong. It it was 3 decades later that I had bought a house next door to my brother, and I had a really big backyard. The uncle that took care of me ended up with lung cancer, and he was getting treated at the hospital that my um, brother got his stitches at. There counselor, there were a lot of rabbits and a lot of rakes because it was a um, really big yard. So I couldn't figure out why I was having all of these extreme panic attacks. Like it wasn't making sense. It's because I later figured out that my body was remembering the events of that 8-year-old memory. And it was like having a freak out session because I was feeling the emotions the same as I did when I was 8, but it didn't make sense when it's a memory that you completely forgot over 3 decades later, right? So the moment I released all the emotions tied to that 8-year-old memory, I never had another panic attack. Your body is not trying to torment you, it's just trying to help you to remember so that you can shift perspective to let go. And that's what we're going to do a little bit. I mean, the emotional reflexology course is a 1-year course. I cannot possibly teach it to you in a 4-hour workshop, but it is something that is available. And today we're just going to go into a little snippet of it, and I will teach you how to release just a statement, and you can use that for your clients based on the sounds that they have got and the tender reflexes. So when it comes to the statements that you're going to use based on the different types of sounds. If somebody has a high-pitched ringing sound, you're going to say releasing up. So I'll go into that a little bit later, but you always release going from the base of the heel up to the top of the toe on the spine reflex from bottom to top, and you sweep up. I am releasing anger, frustration, and attachment to the stress linked to the things the body does not want to hear. And then you sweep from the toe down to the heel, and I am replacing it with silence and sounds that bring pure joy and peace. So when you're doing these emotional releases, I want you to think that sweeping up is getting rid of stuff, sweeping down is actually bringing what you want in. So you always do it on the spine side, and then you would switch directions and you would go down and you would say, I am replacing it with silence and sounds that bring unconditional love, presence, and gratitude. When you have multiple sounds that you're working on, you combine the statements and so that you can do them all in one shot. Now, when we go up to the medication you can find in your guide as well. Now, when it comes to the medication info, there are some medications that can wreak havoc with tinnitus. So here are the descriptions of medication with tinnitus side effects. And I have given you the medical name for it. I've given you examples. I've given you what it's used for and the typical sound. So these antibiotics are often the side effect of high-pitched ringing or buzzing if tinnitus is appearing because of medication, and it may accompany sensorineural hearing loss. It can be permanent. Risk increases with higher cumulative dose. And then I've given you the resource to check it out. But these are things that are important to pay attention to if you have um, clients that have had medication, right?
So if they're on these medications, it won't work for what we're doing, right?
It
It
does
might,
it
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 does.
it does still work, but you have to remember it's going to be a constant battle then because they keep on taking the medication and then they're just going to be regular clients. Like you can't you, you you have to fix the problem, right? And so what I did for the client that I had is I referred him back to, so I printed off a document that I found off of I think it was NICH or HC. It's a
Oh,
medical
yeah.
research place. I actually printed him off the article that explained how it was connected, and so that he had it as a resource. And then he took that to his pharmacist and he's working with his doctor because they're the ones that understand that. I don't understand that. But when he came back, they did agree that it is highly likely that it was the thing that could have been causing the tinnitus. And they switched his medication, which helped. So that's the one that his tinnitus has gone down by a third, which is super exciting. What we will do is I just want to make sure that you're going to have the points that you need to work on and the full method and understand exactly how we're going to do the whole method. Um, and then you've always got access to me in, are you guys in the Reflexology for Tinnitus Facebook group to ask questions and give feedback? And then we are going to go through the scientific research documents as well, because I think it's important to start to document it. And so that reflexology increases its credibility and it's super fun. Like I've got my research folder and oh man, it's so cool to watch the clients, they mark on like this ruler. There's two sides to it. One is the client side and the other side is for the therapist. Let's say that you have a client come in and they have got multiple issues, right? So this ruler right here will say that this is for tinnitus, okay, in the left ear. This is for tinnitus in the right ear. This is for back pain. This is for a sore hip. Okay. So when the client comes in, I would write tinnitus right ear, tinnitus left ear, back pain, and sore hip. On the top ruler, I would get them to mark where their pain is before their session. Like, I just get them to mark it. And then I get them to rate each one on the top ruler. After I am done the session, then I give them the sheet back and they have to mark exactly where they are on the second ruler for each one of those things. So when you do that, they can say it's still the same, or it's less, or it's way less, or it's gone. And it's actually documented. And then I get them to sign it. And then I turn it over, and these are my therapist notes. So anything that I found for like what they said about what their tenderness was during the session, I'll say it at the beginning and then I'll write what it was at the end. So if I'm pressing back pain, right, and the client says, "Oh, that's an 8." Okay, it started at an 8. Where was it after the fact, right? And if it went down to a 1, then I would mark the line there after the session. And then I write my notes where I pressed and I sign it. And then that is scientifically documented with 2 people agreeing, signatures and everything. And it's recognized by scientific research. Isn't that fun? And it's super cool to see. Super cool. So if you are looking for the scientific data research sheets, they are in the student portal underneath Reflexology for Tinnitus, the method. Reflexology scientific tracking forms, they're right here. So
Perfect.
yeah, what you do is you just, this is where you would write right here, right? So left ear, tinnitus, right ear tinnitus, back pain, hip pain, because this is the client rating before the session and after the session. And then this is the therapist rating before the session and after the session. So you would write left tinnitus here, left or right tinnitus, lower back pain, and hip, right? And then this one has, that's the physical side of things. And then the emotional one is in here too. So for tinnitus, we would use the one with physical and emotional because we handle both. But if you want to use it for just your sessions, it is possible that what you're going to do is you're just going to go in here, scroll down, and you can do it just for physical. And if you're an emotional reflexology therapist, you can use it just for emotional, but you guys are going to be using this one for the tinnitus. Make sense?
Thank you.
Yeah, of course. So I'm just going to play these for a moment. So we're going to go through reflexes that we're going to be using on this session. I'm just going to point out where they are, and so that you know, because a lot of reflexology charts are different. Now, in the charts that I use, the brain is at the top of every one of the 10 toes. So you would simply compress or thumb walk the brain reflex. Now, we've also got the pituitary gland. The pituitary gland is the swirl in the middle of the big toe. It's different on everyone, and it seems to be the highest point of the big toe. So if you look sideways, the highest point on this big toe is right here. And I would compress into the pituitary reflex 3 times. Now, below the pituitary, there is a thin little line, and that is the hypothalamus reflex. So how I would work that is just a little thumb walk from the neck to the pituitary. Now, if we are working the eye reflexes, it is at the base of this little, so there's the little bubble on the big toe. It's right at the below, and I compress in 3 times. Same thing in zone 3. Now, the inner ear reflex, is between zones 3 and 4, and I would just simply compress with my index finger or with my thumb. The ear is in the same location as the eye on zones 2 and 3, but it is on zones 4 and zone 5. So again, you just compress in. There we go. Now on the sessions that you have to work the heart reflex, that is in this area right here. So how I do that is it's right at the bottom of the diaphragm reflex, all the way up to the neck. And it's just thumb walking in this area 3 times. And we go vertically and horizontally, making sure to cover that entire area. The heart reflex is the same on the left foot, it's just the opposite side, right? Now, the shoulder reflex is in this small pad here. So you're going to compress. It's the same as working the heart, only it's going to be the shoulder reflex, and you're going to do this 3 times. And it's not you're walking, but a lot of reflexology therapists I see going like this with their thumb. That's not something I approve of. I call that retirement. You want your thumb walking to be moving, but you don't want it to be bending like this. Now, in here, right where the shoulder reflex and the diaphragm meet, is called the axilla, and that's the armpit. So we are going to compress into there. Now, on clients that you have to work the diaphragm, it's right at the edge of the heart reflex and the diaphragm where they meet, and go up to the solar plexus, and then from the armpit to the solar plexus. And you're going to work in this area. Alternating sides. And you do that 3 times. Now, the liver reflex is from zones 5 to zones 2. And the waistline on this foot is right here. So you are going to work from the diaphragm to the waistline in this entire area. So what that looks like is kind of a horizontal. And then you're going to work back. Now you're going to do this 3 times. I'm only demoing it once for time purpose, but you cover this entire area doing the exact same thing that I just showed you 3 times. Now, to do the kidney, you're going to the waistline, you're going to feel that bump on the side of the foot, and you are going to landmark it. So you keep this thumb right here, just like this. You press back the toe and you can feel that tendon. I can feel the tendon move underneath this knuckle. And I'm just going to gently compress the kidney reflex. And then I'm going to take my other hand over here. I'm going to locate the adrenal, my support hand underneath the ankle. I'm going to compress this 3 times. And then I'm going to thumb walk down the ureter to the bladder, lift my thumb, go back to the adrenals, working down the ureter to the bladder, lift, down to the bladder, and I'm going to compress into the bladder reflex 3 times. Then I'm going to fan walk the bladder. And then I am going to relax this whole area with a nice relaxation technique. Now, I am going to be working the small intestine. So the waistline again on this foot is right here. The pelvic line on this foot is right here. So in between those 2 areas for this client, it's 2 finger widths. And I am just going to walk from the pelvic line, which again is right here, up to the waistline, which is right here. I'm just going to walk this small little tiny area 3 times going vertical and 3 times going horizontal. Now you're going to do this 3 times. For demo purposes, I'm only doing it once. Okay, so we do have a knuckle compress that we can go in. The sciatic reflex is kind of in zone 4 or 5-ish in the middle of the heel right here. And if you go a little bit over, this right here is the appendix reflex, and above it is the iliocecal valve. It's just below that heel line there. And then you go up the ascending colon to the waistline, which on this foot is right here. And you're going to hook into the hepatic flexure right here and walk across that transverse colon. So what that looks like is hooking 3 times into the appendix, 3 times into the iliocecal, thumb walk up the ascending colon into the hepatic flexure and across that transverse colon. And you're going to do that 3 times. Okay. Now, I'm going to show you on the left foot because it's going to be easier to see, but the rectum and the sciatic are going to be up the back of the leg. It's on both feet. And the anus reflex is right where that Achilles tendon and the calcaneus meet. It's right in here. So what this looks like is you're going to walk up the rectum, slide back down. Walk up the rectum sciatic reflexes and slide back down. And then you're going to hook into the anus reflex. Obviously, on this foot, you're going to use this hand. So just a little bit different that way, but you're good. Now, when you are working the hip, there is waistline is right here, pelvic line is right here, and there's a little divot in here. So up at the very top of the divot is the hip, and you're going to compress into the hip 3 times. Now, when you are working the hip lower back reflex, you work toward yourself underneath this ankle bone with your middle fingers, and then you're going to work around the base of both ankles at the same time. And get right underneath that ankle bone while finger walking, right? Towards the client. You could do that 3 times. 3 times towards you with the middle finger and 3 times underneath for the client. When you are working the spine, make sure that you are feeling where the spine is. There is, you can follow the bone in the foot. And when I work on it, I do coccyx, sacrum, L5, L4, L3, L2, L1, T12, T11, T10, T9, T8, T7, T6, T5, T4, T3, T2, T1, C5, C4, C3, C2, C1. So you should be able to feel, it feels like a bony point that you're pressing on, and it curves on the foot and it goes down to here and up to here. So the coccyx, the sacrum, the lumbar, the 1 to 5 are usually from here to here. T12 to T1 are usually from here to here. And C1 to C7 are usually in here. When it comes to emotional reflexes, I teach a whole training course on it, but I'm just going to give you the information that you need to be able to get through a session to release the emotions. So if somebody has ringing, high-pitched, or bell-like sounds is how they describe their tinnitus, what you're going to do is you're going to start at the base of the feet, and you're just going to sweep up the spine reflex while saying, I am releasing anger, frustration, and attachment to the stress linked to the things the body does not want to hear, and I'm replacing it. So as soon as you say I am replacing it, you start sweeping the other way from the top of the spine to the base of the spine. Releasing is up, replacing is down. And I am replacing it with silence and sounds that bring pure joy and peace. Now, if someone has buzzing or humming like a bee or an engine, you are saying, I am releasing depression, grief, and anger linked to the things the body does not want to hear. And I am replacing it with silence and sounds that bring unconditional love, presence, and gratitude. You don't have to say these things out loud, but it's just a sweep up to release and a sweep down to replace. If someone has whistling or wind-like sounds, you are going to sweep up while saying, I am releasing depression, fear, and anger linked to the things the body does not want to hear, and switch directions and sweep down. I am replacing it with silence and sounds that bring unconditional love, forgiveness, and gratitude. For clicking or popping sounds, you are going to sweep up while saying, I'm releasing worry, overthinking, nervousness, and attachment to the imagined stories linked to the things the body does not want to hear. Switch directions and say, and I am replacing it with the silence and sounds that bring focus, blank space, and confidence. If somebody has a roaring like an ocean wave or a waterfall, you sweep up from the base of the spine to the top of the toes while saying, I am releasing fear, anxiety, trauma, and attachment to insecurities linked to the things the body does not want to hear, and switch directions and sweep down from the top of the toes to the base, to the heel on the spine reflex while saying, and I am replacing it with silence and sounds that bring unconditional love, peace, and confidence. If a client has a heartbeat or pulsing sound is how they describe their tinnitus, you are going to sweep up while saying, I am releasing heartache, shock, and attachment to any past traumas linked to the things that the body does not want to hear, and switch directions, sweep down. I am replacing it with silence and sounds that bring unconditional love, peace, and confidence. We're going to go in and I'm going to show you all of the specific ear reflexes. Going through all of these points on the ear, A is right where this half circle is. You are going to compress right here very lightly, and you're just going to feel around. Some people will have tenderness if they have imbalances in there. And I'm just going to ask the client how it feels. Is there anywhere in there that is a little bit tender?
Yes.
Whereabouts? Right there?
Yeah.
So when I find that spot, I am just going to press and hold it. And if you had to rate it on a scale of 1 to 10, where would it be?
6.
Okay, so I'm just going to lightly press and hold it. There's like the instrument is just sitting on top of the skin. I'm not pressing it at all. It's just the weight of the instrument. Okay, and is it releasing?
No.
It's holding tight.
Mm-hmm.
So I'm just going to leave it on here for up to 10 seconds. And is it still holding tight?
It's releasing slowly.
Scale of 1 to 10, where would you rate it now?
5.
Okay, that's really slow. So on here, we're definitely going to put an ear seed because it needs additional support, and this is probably going to be an emotional reflex as well. We're going to go up to B, and B is little ways, kind of halfway between this part and this part of the ear. So you're going to compress in here. Is that tender right there?
Yeah.
So I'm just going to move around. Is there anywhere in here? Are there any tender areas in here at all?
No.
Okay. So with this client, there's nothing in the B area. The C area is almost by the hairline over here. Is there any area in here that's tender?
Not really, no.
These are all good.
Mm-hmm.
D is going to be just below here. Any tender areas in here?
No.
Okay. E is going to be right in here. Any tender areas in here?
No.
Okay. F is, you're going to need support. So your finger's right behind here. And this is the inner ear reflex. Is that tender right there?
Yes.
Scale of 1 to 10, where's it at?
I'd say 4.
Okay. Just tell me when it's releasing.
It's releasing.
Okay, scale of 1 to 10, where's it at now?
I'd say about 3. 3.5.
Okay, so we're going to put an ear seed on this one. You can use your fingers too, but we're just going to check it here. And then in this one, you're just going to use light pressure. Is that one tender?
Yes.
Scale of 1 to 10.
6.
Okay, is it releasing?
No, it's holding.
Okay, that one's going to need an ear seed. H, the final one, is right in this crease here. And again, you might need to put a little bit of support there. Is that tender right there?
No.
Okay, so we know we're going to have to put an ear seed here, here, and here. And we will get to that. So we are going to put an ear seed here. And ear seeds can stay on for up to a week. There we go. Ear is set. So now we're going to have to work behind the ear to get to K. And it's right where this bump in the ear, it has a little bit of a ridge. You're just going to go around and it's going to hit right in here. So on a scale of 1 to 10, is there tenderness right here?
No.
Okay, in this client, it's fine. So we'll leave it without an ear seed. Okay, and now we just got the hands left, and then we're going to start to practice on where to get our right between zones 4 and 5, right below the knuckle. This is where A is going to be on the hand. B is, it's kind of in line with zone 2. So when you go zone 2, you go right above the wrist crease, and it's B is around in here. C is below the wrist on the dorsal side, right below the wrist bone. So you can press in there. D is on the palmar side of the hand, right below the wrist crease in zone 2, right in here. E is on the palmar side in zone 4, again, right above, right below the palmar side, right in here. So when I work them for the client, I'm going to use compression, right? So make sure that your support hand is underneath, and I'm just going to compress in here. So is there any tenderness? Scale of 1 to 10 right here.
About 3.
Okay, so I'm just going to hold it here And just tell me when that pressure releases.
About now.
Okay, so now it just feels like pressure? That's
Yes.
perfect. So now what we're going to do is I am going to have my working hand and my support hand, and I'm going to compress right up here. Scale of 1 to 10, where's that?
About 4.
So I'm just going to gently press and hold that reflex
Right away.
that released.
Mm-hmm.
Okay. And now C, we're going to go right above this wrist bone. Where's that?
Nothing.
Okay, so that one isn't sore. I'm going to make sure that I just didn't miss a spot. So I'm going to compress around in that area and it's all good.
Yeah.
Now D is going to be right in here, zone 2. Where's that at?
About 2 or 3.
Okay, so I'll just compress using this hand just so that people can see it. And okay, scale of 1 to 10. Where's that at?
It's releasing right away.
Okay, does it just feel like pressure?
Yes.
Okay, and now E, we're going to go into here in between, it's at zone 4, and I'm just going to compress in here. Is that tender?
No.
Okay, so I'm just going to feel around this spot just to make sure that there isn't any area that is different. Is that good?
Yeah.
Okay, so E doesn't apply to him. And those are the hand reflexes.
Yeah. Question though, do you work on both hands or just the one side? And same with the ears. Do you do both of them?
Yes.
Okay.
Yes. I'm going to demo it. So A is right here. Is there any tenderness right there?
No.
Okay. B is right up here. Any tenderness in there?
No.
Okay. Uh, C is right in here. Any tenderness?
No, not now.
Okay. D,
No.
E,
No.
F.
I'd say 3.
Okay, so I'm just going to press and hold it and just tell me if it releases.
Slowly it is.
Okay, so we know that this one has got a tender spot and we're going to have to put an ear seat on it. Then let go.
Yeah.
G, I put my finger just behind this little nub and so that I have some support, and then I just press that reflex. Scale of 1 to 10, where's it at?
I'd say like 3 as well.
Okay, just tell me if it lets go.
It's holding.
Did it let go?
Yeah.
Okay. H is right in here. Scale of 1 to 10. Where would you rate that?
No.
It's good.
Yeah.
I is just at the bottom of this nub right here. Scale of 1 to 10. Where's that at?
No.
No. And J is right above. There's like a little U right here. It's just above that crease. Scale of 1 to 10. Where's that at?
No.
Good. All right. So what we will do is we're going to put ear seeds on the reflexes that were tender. And I'll just do it right here. I have to remember which ones they are. It was this one right here.
Mm-hmm.
Oh. Okay, right there. And then the other one was right in here.
Mm.
Right? Now we have got one that we're going to try, and it's K. So K is right here. Scale of 1 to 10. Where's that at?
No.
You're good?
Yeah.
All right. right, so now we are done his ears and we have the ear seeds there. They're going to be there while we're working down the arm. Okay, so I'm going to work on the arm on this side first, right below this knuckle, right here. There's the knuckle, there's the web. It goes right below that knuckle. It's just going to be in here. Scale of 1 to 10. Where's that at?
No,
Nothing?
nothing.
Okay, so that's A. Then I'm going to turn his wrist. Okay, so on this side, B is going to be in line with zone 2, and you're going to go above the elbow to right here. Compress. Scale of 1 to 10. Where's that at?
0.
Okay. C is going to be on the other side of the hand, right below the baby finger, right below the wrist bone, or right above the wrist bone, I guess. And where's that at?
I'd say like 1.
Okay, just tell me when it releases.
It's releasing.
Do I let go?
I think so, yeah.
Okay. Now, D, when you turn your hand over, is going to be in zone 2, and it's going to be right above the wrist crease. So it's right in here. Scale of 1 to 10, where's that at?
0.
0. Good. And E is going to be more on the opposite side, zone 3, 4-ish, right around in here. And you can feel around to make sure you're on the right spot. In here, scale of 1 to 10, where's that at?
Like 1 or 2.
Okay, just tell me when it releases.
It's releasing.
Do I let go?
Yeah.
We are going to, before I go to the feet, I would go to the left ear and try the same thing over there. All right, now on the left ear, we're going to go, and I'm just going to check again. So right here is a tendon.
No.
Okay. B.
Maybe 1 or 2.
Okay, so I'm just going to hold B here for a second.
It's releasing.
Okay. C.
No.
D.
No.
E.
No.
Put your support hand behind. F.
4.
Okay, so this is a 4. I'm going to hold it.
It's releasing slowly. It's like 2, 1 around there.
Do I let go?
Yeah.
Okay. G.
It was like 2 or 3, but it's letting go.
Is it gone?
No.
Still holding?
Yeah.
Okay. H.
No.
I.
No.
J.
No.
And K.
It's releasing.
Where's it at?
It was like 2 or 3. Yeah.
Okay. So now I'm going to go on here with the ear seeds again. And we're going to put an ear seed right here. Right here. So anywhere that the tenderness held and took a slow time to release, you're going to put in on an ear seed. If the ear seed hurts or becomes uncomfortable to the point that it's disrupting sleep, you can tell the client to just take that ear seed off. Now, we're going to move on down to the right hand. Can you guys see his hand? Okay. So right above the knuckle, the web, there's the web, and then you press in here for a scale of 1 to 10. Where's that at? Did I lose my test client? With scale of 1 to
No.
10?
What?
Is it tender?
No.
Now, right above zone 2, you're going to go right above the wrist crease right here, and you're going to compress into here. Scale of 1 to 10.
No.
Okay. And then with palm facing down, right above this wrist right here, scale of 1 to 10.
No.
No. D is in zone 2. Zone 2, D. And you should be able to see it right there. Can you see it? Scale of 1 to 10, where's that at?
0.
Okay. And then E is on the opposite side, right in here. And it's kind of between zones 3 and 4, right in here. Scale of 1 to 10.
No.
Okay. All right. So when you are doing reflexology session, you're going to do the full foot session. But what I'm going to do is I'm just going to demo this sheet. So this client has ringing, the high-pitched bell like. And what I'm going to do is I'm going to show you how I hold these reflexes. So again, you're going to do a full foot reflexology session. But when I get to the brain, I'm going to press and hold the brain reflex. Scale of 1 to 10. Where's this? Okay, so this isn't tender for the client. And then I'm going to try the pituitary. Where's that at?
That. That's sore now.
Scale of 1 to 10. Where's it at?
It's like 4.
Okay, it was at a 4. So I'm going to just keep pressing and holding it. Scale of 1 to 10. Where's it at now?
It's released.
Okay, so now it's released. Now I'm going to go down to the hypothalamus. Where's that? Scale of 1 to 10.
It was like 2 now, and it's released.
Okay, so the hypothalamus has released. The eye reflexes. Scale of 1 to 10. Where's that eye?
It's fine.
That one's good.
Yeah.
And you're going to compress the brain on this toe. Scale of 1 to 10. Where's that at?
Yeah, that's fine.
Okay, brain on the third toe. Scale of 1 to 10.
That's fine as well.
Eye. Where's that at?
No.
Ear. Inner ear.
No.
Okay. And then brain on the fourth toe. Where's that at?
No.
Ear.
No.
Brain on the fifth toe.
No.
Ear.
No.
Okay. And then we're going to compress into the solar plexus. Is that good? And the liver.
No.
Okay, so for this client, there was no tenderness in any of these areas. If there was, I would press and hold those reflexes for up to 15 seconds before going on to the next reflex. And again, these are just the focal reflexes during the full reflexology session. So when I'm doing a full reflexology session, I would do the brain, pituitary, hypothalamus, um, sinus, pineal, mouth, nose, teeth reflexes, but I would stop and pay more attention to the brain, the pituitary, the hypothalamus, because I would be looking for feedback in these spots. Okay, so that's the liver. Gallbladder,
No.
kidney,
No.
adrenal,
No.
ureter,
No.
no. Okay, bladder.
Maybe 1 or 2.
Okay, so now I'm just going to press and hold the bladder because he said it was a 1 or a 2.
That feels good now.
Okay, now I'm going to go up the rectum and sciatic. Is that tender? No. And into the anus reflex, which is right here, right? And the rectum goes up the back of the leg, but the anus reflex, I'm pressing it on this over here, and it's good.
It was like 1 or 2.
Okay. Now the whiplash drainage point of the foot, and so I'm going to compress into here, scale of 1 to 10. Where's that at?
No.
Good.
Yeah.
And then the groin lymph, I'm going to press the foot back, and I'm going to work ankle bone to ankle bone, switching hands. That's good.
Mm-hmm.
And then I'm just going to do the drainage point just to make sure. That's good.
Mm-hmm.
Okay. Now we have to do the spine reflex. Okay, so the spine reflex, again, you feel where that bone is going up the spine. And you're going to compress into the coccyx, sacrum, L5, L4, L3, L2, L1, T12, T11, T10, T9, T8. Ooh, did you feel anything right there?
Yeah.
Scale of 1 to 10, where was that at?
It was like 3.
Okay. 7, 6, 5, 4, 3, 2, 1. C7, C6, C5, C4, C3, C2, C1. Now I'm going to work back. C1, C2, C3, C5, C6, C7. Any areas in there that were tender?
No.
T1, T2, T3, T4, T5, T6, T7,
Sore right in there.
right here.
Yeah.
Okay, scale 1 to 10, where's it at?
5, 6.
Okay, so just tell me when it releases.
Starting to now.
Did it let go?
No.
Okay, so this one is still holding. It's a cranky reflex. So this client has high pitched ringing, and when I press, okay, scale of 1 to 10.
3 now. It's not as bad as it was.
Okay, so I'm just going to press and hold it for, is it letting go?
Slowly it is.
Okay. In this case, it's this reflex that is super tender and it will not let go. So an emotional reflex holds for longer than 15 seconds. Well, in my experience, it holds on for forever. It just doesn't let go. So I'm going to start at the base and work my way up. And I am going to release. I am releasing anger, frustration, and attachment to the stress linked to the things the body does not want to hear. And I am replacing it with silence and sounds that bring pure joy and peace. So now, where's that?
No.
There's nothing?
Yeah, very little. Maybe 1 if that.
Okay, so he said it's at a 1 if that. Is it releasing? And it's gone. Okay, so then I'm just going to keep on working my way down. Any other tender spots?
No.
Okay, so you are going to find on this list, when you're doing your foot reflexology session, there is a list of reflexes to focus on. The tender reflexes that are in this, like the reflexes that hold for up to 15 seconds with these reflexes, you are going to use the release method based on the sound of the ringing. And you're going to use this statement to work up to release and down to replace the positive statement. So with this client, the tenderness was started at a 5, went down to a 3, and then after the statement, it finally released. So you're going to do the same thing on the left side with the full reflexology treatment. And then you are going to ask the client, your ears, how do they feel? Do you feel like there's better sound? Is the ringing changing? Or is it the same?
The ringing isn't as loud.
Okay, so this client said that the ringing isn't as loud. Like scale of 1 to 10, where would you rate the ringing now?
Like 1 or 2.
Okay, so the client's ringing went from a 5 down to a 1 or a 2. Now, you can use these reflex points in this session if you have enough time, but these are focal points for the additional session. And I'm just going to show you where all of these reflexes are. You guys can see the leg? Okay, on the fourth toe on the lateral side, this is A, and it's right below the toenail, and you're going to compress in here 3 times. Scale of 1 to 10, where's that at?
No.
Nothing. So again, if I was to move the fourth toe out, the nail ends right here with this client, and it would be right here. That's where you're looking. So this is point A on the foot chart. The third toe is kind of the same thing. You're going to work right in here, and I'm going to compress right here. How is that?
No.
Okay, so this is point K. Now, as I move over, this is point I right in here. So when you move into the big toe, I is going to be, just need to see it right here. So it's going to be this spot right here. Now, B is, this is the, where you can press the web, and it's right below right here. E is more by the lymph drainage point, just below it on the bone, right here. That's E. Now, D is between zones 1 and 2, and it's going to be, and you're going to have to feel around. 8 billion people, no two are the same, right in here. Can you see it? Hold on. Is this thing not locked, or what's the case? Oh. So D is going to be up and just below the ankle bone. Now, C is more up zone 4, and it's going to be above D past H, which is right in here. And H is going to be down in between, right in here. F is going to be, so there's the calf is right here, and it comes up, and it's just in zone 1. I felt a click right there. Can you feel that? Scale of 1 to 10.
No.
Right there. Nothing. And then G, it's right below the knee. So G is going to be just, there's a bone here that comes down from the knee, and it's just beside it on this side. Right there. Is that good?
Yep.
J is right below the ankle bone, right in here. And it's on both feet, but there's like a little dip underneath this ankle bone, a little dip right there. Can you just compress into there? Is that tender?
No.
No. So these reflexes, if you have enough time for the foot reflexology focal points during the first session, you can use them, but I use them more in the second session after I've had some feedback. And so again, in order, there's going to be A, B, C, D, E, F, G, H, I, and J. So after that client session, at the beginning of the session, I had them fill out the top on what their right ear hearing loss was. And this client, he said that he had 30% hearing. And in the left ear, again, he had 30% hearing. Back pain today for this client was 40%. And the left ear was a 5. And then the right ear was a 5. Now, after the session, I just asked for the feedback, and um, the hearing loss he felt was better, and I would rate it at a 15, 15% hearing loss. So it improved quite a bit. Same thing with the left ear hearing loss. I would say that that was at a 10%, which is awesome. The back pain for this client, I would say is at about a 12%. And client rating after the back pain would be 12%. The left ear right ringing, it went down to 20% for this client. And then ringing ear, it again went down to 20%. And I didn't even do the full method on them. Like I didn't do a full foot session. All that I did for demo purposes was pressed the focal reflexes and the reflexes for paying attention. Plus I did the emotional release. So that's quite exciting. It's fun. So now what we're going to do is we are going to go and we're going to find the reflexes. So as this video plays, I want you to be able to tell me which reflexes this is. So you're going to have to go off of mute and using your ear reflexology focal points in your guide on page 6, let me know what point is this?
A.
A, correct. Where's that?
G,
G, that's right. Which one is this?
H.
H is correct. What's this?
B.
B,
B. B is correct. Where's that one?
J.
That is J. Yep. How about this reflex?
C,
C.
C. That one?
D.
D. This one?
E.
E is correct. Ooh, which one?
F.
F. Which one?
I,
H.
That one's I. The one that is behind the ear. Right where
K.
is K. Yeah. K is going to be right behind the ear. So this one doesn't have a big kind of bump, but if you went, it would be like right in there. And G is the one that is right in here. Okay, I is going to be right on the face, right in here, just at the end of kind of like this bubble. Good. Good job. So now what I want you to do is I want you to locate the hand reflexes on your own arm. And I'm going to go to gallery view here. Okay, so in gallery view, I want you to show me where A is. So Carla, it's going to, yeah, you've got it, Crystal. Carla, it's going to be just the web. If you were to do the neck jaw limp and you see where those knuckles pop out, it's right below there, right in.
Yeah.
Good job. Perfect. That looks great. Okay, and then B, so you're going to go up zone 2 all the way up past the wrist, and it's going to be right in here. That looks great. Yeah. C is going to be right above the wrist on the baby side. Baby side.
Oh,
No, it's going to be more down on the bottom. So if I was to do it, this is the wrist. It's at the base of the wrist. You're on the top of the wrist. I want you to go to the bottom of the wrist.
like above the bone? Under my what?
It's like right here. Down and then come down. You're more in zone 4. I want you to come down a little bit more.
On the side?
Go back towards so if you look at C, okay, so here, can you see where my wrist bone is?
Yeah,
So you go just below the wrist bone. Just take your finger and go right below the wrist bone. You're going on top of the wrist bone. I want you to go underneath the wrist. There you go.
there.
I'm gonna
Okay.
I'm gonna put my watch on so that you can see it. Just hold on. So I got my watch on, right? If I was to go, it's going to be right where that watch band is, right here. I can't see your wrist. So you've got it. There you go. Yeah, good.
Oh, quite high up.
Yep. Yeah,
I watch on the picture.
yeah. And then D is on this side, right in here. Good job. I can't see it, Crystal. You're not in the screen. There you go. Yep. Um, that's D. And then E is more in zone 4, right here. Move it a bit over, Crystal. Like move it more into zone 4. Yeah, there you go. You got it. That looks great. Good. Now the feet, when it comes to the feet, okay, I'm going to show this to you again, just in so that you have it. So on your feet, I want you to press A first. So A is going to be right in here.
On the fourth toe?
It's the 4th toe, but it's on the side of the baby toe and right below where the nail is, right in here. Got it? I can't see your feet, but I'm gonna have to trust you. And then the 3rd toe is the same thing, right? Right in here.
That's K.
Or sorry, that's K. Yep. And then I is going to be right over in here too, but it's more up on the top, like it's below the nail, but it's kind of on top right here. And you should be able to feel around and feel a little bit of a tender spot. Is it tender anywhere in there?
Yep.
So, so if you find that tender spot, you're just going to press and hold it and scale of 1 to 10. Where would you rate that tenderness?
Probably 4.
Okay, so just keep on pressing and holding. And is it still holding?
Yeah, I noticed when I was practicing on the ears. Oh, now it released.
Okay. So if
It
you've got
feels
one that, what I'm looking for is one that presses and holds and will not let go. When you get one of those, just let me know. Okay.
okay.
Now, we're going to go to B, and B is going to be right about in here.
That's kind of like right where that first knuckle is, right? Or not knuckle, but
Yeah, it's right below. It's kind of like if the web was here where you're compressing the web, it's like just a finger underneath that, right?
okay.
Yeah. And then E is where, okay, so the whiplash point is like right here, and it's right one one point right below it. Got it? And then D, you're going to go up, and it's right above, like if I was able to bend this ankle, it's kind of right above it, right in here. And then C would be right here. And just feel around, there should be a little bit of a tender spot. Did anybody find the tender spot? H is more in zone 3 between the two. It's right in here. Now F is on the same side as the big toe, and you know where it kind of goes up and then it goes right below the calf? You're just going to come up on the side of the big toe, and it's just going to be like literally right in here. Like just pretend that this is where the calf starts. It's going to be right in here.
Belinda, for H, is it like almost right on the shin bone?
Yeah,
Or
just
is
a little bit towards the big toe, right on the shin bone. Yeah.
okay. Thank you.
Did you find the sore spot?
On the F, yeah, but it released.
Okay. And then G is just you know where that bone kind of goes up right below the knee. You're going to go on the more on zone 4, right beside the bone. And it's going to be 3, 4, right beside the bone, right up there. Is there a tender spot in there that you can feel?
That's that spot that they call the point of 2000 diseases, isn't it?
I don't know. I'm not sure. Rub it and so that it gets fixed, if that's what it is.
Yeah, that one I rub all the time.
Good job. And then on the medial side, so it's the ankle bone right in here. J is going to be right in here. Got them? And now we're going to do them on the other foot. So grab your other foot and we're going to find a tender spot in there. So again, A is in zone 4 on the side closest to the baby toe, right below the nail, right in here. And if you got a tender spot, let me know. K is on the third toe, right here. I is right in here, kind of up right in here. B is going to be right in here. E is going to be right down here. D is going to be right here. C is going to be right in here. H is going to be right in here. F is going to be on the medial side, right above where the calf is in zone 1. G is going to be in zone 3, or zone 3, closer to zone 4, just off of that bone, right below the knee. The point of 2000 problems is what she said. Illnesses, whatever you said. And
The
then,
Burl Crane thing. If
okay,
you got your book,
no, I didn't read the Burrow Crane book yet.
yeah.
Right here. There we go. Did you find any sore reflex points at all?
J on both feet.
Okay, so I want you to press and hold J on one foot and tell me scale of 1 to 10, where is the tenderness with that?
5.
5. And I'm going to combine the statement for you because you've got 4 of them. Okay. So what I want you to do, and you can practice this too, is you're going to start at the heel of the foot. What did you say? It was at a 2?
5.
Okay, a 5. Okay, so
Yeah.
I want you to let go of the reflex and I want you to sweep from the heel up to the toe, and you're going to sweep up on
Okay.
the spine reflex. And then when I say switch, you're going to sweep down. Okay.
Okay.
We're going to start with sweeping up. Keep on sweeping up. I am releasing anger, frustration, and attachment to the stress linked to the things the body does not want to hear. I am releasing depression, grief, and anger linked to the things the body does not want to hear. I am releasing worry, overthinking, nervousness, and attachment to imagined stories linked to the things the body does not want to hear. I am releasing fear, anxiety, trauma, and attachment to insecurities linked to the things the body does not want to hear. Switch and go down. I am replacing it with silence and sounds that bring pure joy and peace, unconditional love, presence, and gratitude. Silence and sounds that bring focus, blank space, and confidence, and sounds that bring unconditional love, peace, and confidence. Now, I want you to go back and press that J reflex and tell me how tender it was. It was a 5, and now where is it?
2.
Okay. So I'm going to get you to sweep up again. And
Okay.
I am releasing depression, fear, anger linked to the things the body does not want to hear, and switch. I am replacing it with silence and sounds that bring unconditional love, forgiveness, and gratitude. Now test that reflex again. Where's it at?
0.
It's clear?
Yeah.
Okay. And now we didn't rate your tinnitus when you started it, or did you? Scale of 1 to 10 in your left ear, where was it at?
No, I didn't actually because I have fans and stuff going and I can't.
Okay.
Um,
Just monitor it and see where it goes. Okay. And now J on your other foot. I want you to press the J on your other foot.
it's gone too, actually. It's released.
You passed. You passed. Great job.
Yay.
Great job. Great job. And so when you see it all come together, are there any questions that I can answer that I might not have covered for you today?
No, when I was like when you were doing your client, I was poking with these at the same spots. And it almost feels like when I wrote down BFK, really bad, GH mild, but it felt like the ones that were really bad, if I held it there, it almost like it turned up, like it was.
It got worse. Okay, so what I want you to do is on the reflexes that were really bad, I want to see you put on ear seeds on those reflexes. Get your ear seeds and just put the ear seeds on there.
Okay. And I had troubles getting them off the plastic. Do you pre-rip a few before? No,
No, it's
you
okay.
just make them.
I use so inside the student portal, I have links to different seeds that I use. Um, I used to get my seeds from a specific place where you needed a membership from. Number one, they were kind of expensive, and number two, Um, it's kind of a lot to get them, so I just ordered them off of Amazon, but I did put links in there. And so that you can get them. I got the little gold ones that work really, really well because the tape is clear and the the little pellets are gold and they're kind of hard to see, so people don't mind wearing them. These ones, they look like somebody's got a band-aid on their ear. You know what I mean? Like I don't care because my hair covers everything, but I don't know about men. But you can also get the ones that look kind of like earrings. They look like diamonds, like they're crystals, which aren't too bad.
Fancy.
Yeah, but they're all in, I will show you where those are in here. So then, yeah, you would just stimulate it with your hand is what you would do. So right
So
here, this is what they look like, and they're economical. Like it's everything that I do is in Canadian dollars, obviously, because I'm in Canada. But I mean it's 25.99 for 100 of them. It's not, and I mean on any given client, I would use about three or four, because I'm only working on the tender reflexes, right?
okay, and am I just doing the right ear, not the? I'm
Have
just
you
doing the
have you got bringing in both ears?
usually just the right ear.
Okay,
Oh,
then you just put it on the right ear. Then you're fine.
I put all of them.
Yeah. Those are all the
Okay.
ones that are sore.
Yeah,
Good. Perfect.
B B H or G H B, all three of them. So do you need each one of them side by side, like a little row,
Yeah,
or if
they can.
okay,
Like if they're the ones that are sore, that's what you do. If it's interrupting your sleep because they start to throb, take them off. You don't need to
okay.
sound good. Are you confident putting them on, Carla? You okay?
Yeah.
Good. Do you have any questions for me about the training? Is there anything that you feel that you need to know, or you just need practice doing it?
Once I work on Dennis, which will be after hunting, which will make his tinnitus worse.
That's fair.
But yeah,
Sure,
then
block.
I might have questions.
And that's okay because you're in the Facebook group, so you can ask away inside there.
Yeah.
It's good. It's pretty hard to catch it the first time. There's kind of a lot of information going in, but you guys can keep on watching it over and over and over, and it'll keep on growing. So you're not going to lose access to the student portal. Carla, I don't know if you had access to the foot.
Yeah, I did. It's showing up there.
Yeah, I think I added it for you. I don't think you had it before.
Oh,
I think, or maybe, but needless to say, you got access to the foot, and they just finished changing a ton of stuff. They changed the health records, they changed the um code of ethics,
yes.
they changed like so much stuff. And so all of that stuff is going to be going into the foot portal. I'm probably going to be doing that tomorrow. So
I will be able to go back in and see the updated in the foot. Okay.
yep, that's where it lives. I don't do refresher courses. I just give everybody the information because I don't believe in that. So, I mean, some people do, and that's great. I just, yeah, no, no. I think we need a community, so that's why I'm a little bit goofy with that. But it is
So
good.
ear K Yang Wei tinnitus point. What is that's just the name of the reflex?
Yeah, so the tinnitus, that's J. It's right in here. It's right here. Is it not J? It should be J.
Ear Shemin is J, and ear K is tinnitus point Yang WEI.
Yeah. And so those in ear reflexology, like if you were to buy an ear model, I think I got the link for here. Look right here, that's where it's coming from. It's It's saying shaman is right here. See, right there. And then when in ear reflexology, you learn that those are tinnitus points. And this one is another tinnitus point. You just learn that it's part of ear reflexology. Ear reflexology is like a 1-year course. Emotional reflexology is a 1-year course. Hand reflexology is a 1-year course. But I just gave you the points that you need specifically for tinnitus today,
Okay.
just to make your life easier.
Hey.
Hand reflexology is really cool because it helps, like if you close your fist, it's in the shape of a heart. And people seem to relax a lot during the hand reflexology side of things. Like it's just you use your hands when you're doing the hand reflexology reflexes. You can use the pointer with the ear just to detect. But yeah, ear reflexology, it's a very short session. It's only 20 minutes, but it is powerful because the reflexes are really close to the surface of the ear and they're close to the brain. So it's really good for doing really quick sessions that make people spa drunk in a short order, like very short order. And it's really good for people suffering with a lot of different things. Emotional reflexology is the one that I am most known for. Obviously, I developed it, but it is the one that keeps me the absolute busiest because there are so many people going through emotional turmoil right now. And when you can't get rid of pain, it's like, how do you fix that? Somebody asked me about if somebody is suicidal, does it help? The key ground emotions for suicide are usually guilt and shame. It's just stuff that's too heavy to deal with. And you release that during the session and they do feel lighter. It's wild. It's super neat. Fun. But you've got the tools that you need to be able to do reflexology for tinnitus. And so if you got any questions, make sure that you're in the Facebook group. You guys were both able to get into the membership, and so you guys are fine. Thanks, ladies. It was a pleasure, and I'm looking forward to hearing the updates on how you help people with tinnitus. It's the wildest, funnest thing.
Mhm.
Makes my heart full.
Perfect.